morning, everyone. So, our today's topic is key concepts of good laboratory practices, their significance in the daily, whatever the work we are doing. So, before start of this presentation, I would like to tell about that. So, whatever the concepts, whatever the basics, today I am telling, this most of the people already know. So, these are the basic things. So some of the people they might don't know, so they will learn. If someone feels that I know each and everything, don't worry. Please listen carefully. If you had any further improvement, we will definitely do that. So this entire presentation is described about two things. One is what are the basic fundamentals while working in the QC laboratory, what we need to learn, and second, whatever the calculation we are doing in the daily work environment, like while you are doing in the wet lab, while you are doing the chromatography, while you are doing the gas, GC, whatever. So whatever the basic calculations, just I am explaining. So start with that. Seriously? So the first start with that qualitative analysis. And what is the difference between the qualitative analysis and quantitative analysis? So first of all, what is meant by qualitative? The qualitative is identify the presence or absence of a particular substance or a functional groups in the sample to determine what components are present. For example, you take microbiology example. If a salmonella is a present or absent, if you are given on product, if you are inoculated, if the growth observed positive, then whatever E. coli or salmonella, whatever, if it is a present means we can confirm that there is a microorganism in that. In the similar way, if any identification test, like if you are mixing some XYZ compound with the XYZ solvent, then it produced a reddish brown color, then it shows the effervescence fumes. In those we can easily identify that whether it was present or absent. In both way we can determine that. So qualitative analysis is more about whether it was present or absent, whether it was confirmed this particular product or not. These two only we can able to identify. Whereas come to the quantitative analysis. The quantitative means measure the amount or a concentration of a substance in a sample. So for example, I have a drug paracetamol. So actual paracetamol, how much quantity is present in that? There is, if you see that there are different label claims. The same drug you will get it in the 25 mg, 50 mg, 75 mg, 100 mg. So based on the person who needs, for example, someone is required based on the body weight, someone is required 50 mg tablet, someone is required 100 mg tablet. So based on that, how much quantity of that particular amount of the substance which is present in the drug, which can use measured by the quantitative analysis. Simply, quantitative means we are quantifying how much is exactly. The purpose to determine how much of a component is present. The methods techniques are include titration, mass spectroscopy, and grammetric analysis. Like even chromatography, whatever. If you are doing the manual titration, you say that ISI is 90%, SI is 98%, like this. Next. And next another one is, first thing is whether it was qualitative or quantitative, and second one is the basic. If you are doing any kind of testing while you are assessing assay value, whatever the product you are giving acid basis or dried basis or anhydrous basis. So what exactly acid basis means? Refers to the total weight of the substance including all components such as water, solvents and impurities. So basically, take any API product. So it includes everything. It might be having the water, it might be having the solvents or inorganic material. These three included. If you are estimating the amount of the substance by these, including these three, we can call it as acid basis. If it is a dried basis, refer to the weight of the substance after it has been dried to remove moisture but may still include other volatile compounds. For example, why we are performing the KF test? So if you are doing Conner-Fisher test, moisture content test, it is only used to determine how much percentage of the water which is present in the molecule. So we can able to determine that once if you are measuring the moisture content, then you will get the some value. If you are minusing from the absolute 100%, then you will get the dried basis. Sorry, dried basis means whatever. Actually, here it is older than actually. So if it is a dried basis, it's wrong. Dried basis means if you are drying or something, whatever the product if you are dried. So whenever you are drying, what are the components we can able to eliminate? One thing is water, and second thing is volatile substances. Volatile substances means whatever the solvents we are using, those we can able to eliminate with this. While anhydrous basis means where there is a volatile represents a dry pure material, refers to the weight of a substance that is completely free of water and any other volatile present, the dry pure material. So in a simple form, if you have any water which is present in the molecule, you can able to remove with the anhydrous basis. Means if you are removing the water which is having the volatiles. If a dried basis means simply if you are doing the LOD, if you are removing the LOD. Correct kada నేను చెప్పేది నేనే కన్ఫ్యూజ్ అవుతున్నాను.
డ్రైడ్ బేసిస్ ఎల్ఓడి ఓకే
డ్రైడ్ బేసిస్ LOD యాక్చువల్లీ ఇక్కడ ఉల్టా ఇచ్చింది అదే డౌట్ వస్తుంది.
డ్రైడ్ బేసిస్ ఎల్ఓడి
ఓకే slide this is next page in a simple way. Don't go with any other. So as is basis means which include the sample, which include water as well as the volatile substances as well as the inorganic particles, inorganic matter which is present. That is called acid basis. If it is a dried basis means what we can able to do. So whatever the volatile substances while drying through the drying by doing the LOD at the normal 105 degrees centigrade or vacuum temperature, you can able to evaporate the whatever the solvents which is present in the molecule, that is called dried basis. If it is an anhydrous basis means whatever the moisture which is present in the molecule that we can able to remove through the coefficient test or Kf coulometer whatever. So with the relevant techniques. Now you got the difference. Next. And next, third point. What is the major difference between the assay, purity and potency? What exactly means? The assay means a quantitative analytical procedure to determine the presence and concentration of a specific substance in a sample. For example, whenever you are doing any kind of test, whether it was paracetamol, whether it was atorvastatin, whether it was any kind of molecule, why we are doing assay? Means how much quantity of the exact quantification value we are getting through this assay technique. Next, the measure of the amount of the desired substance in relation to the total mass, including impurities or other constituents. So when we are getting the purity, for example, if you are injecting or if you are determining any purest form of the compound, so whatever the main analyte peak we are getting, other than the impurities, we can call it as a purity. And second, after removing whatever the impurities and everything, whatever the main analyte we are getting, that is called purity. The potency, the strength or biological activity of the drug or a compound, often expressed in terms of its effect at a specific dose. To evaluate how effective a drug it is producing a desired therapeutic effect, may involve biases, pharmacological testing. A potent drug required a lower dose to achieve the desired effect to compare to a less potent drug. So basically, potency is very important. For example, if you want to make a drug, so first what you will take? You take the API and you mix with the excipient and you get the desired whatever the concentration. For example, whatever the API you are taking, for example, the potency of the API if it is a 60% or 70% or 80% or 90% or whether it was a 100%. If the potency, based on the potency, you can able to get the desired concentration, desired label claim of the particular product. The potencies means the exactly how much quantification. For example, if in a paracetamol drug, you made a paracetamol tablet, the 25 mg paracetamol tablet. So exactly if it is a 25 mg means the drug which is containing the 25 mg of so and so paracetamol. Exactly. So if you are, whenever you are preparing any formulation, whatever the API if you are using, based on the API potency, you need to add more amount of the API to get the desired formulation. So likewise, the assay is like that. After you are adjusted according to your needs. For example, there is a product is having the 90% potency. If you want to produce a one molecule having the 5 mg level length, so you will calculate accordingly. Then you will adjust the API component and you will get the 5 mg. So this assay which is indicated that after you are preparing each and everything, you manufacture, you will get the desired product, and then after you are preparing the desired product, what exactly, how much percentage, if you are targeting 50% of a particular drug for assay value, if you are whether it was getting the 50% or not, whether you are targeting 100%, then it is referred as assay. Where there is a purity in the sun, where there is without any involvement of other. For example, if you are injecting directly one impurity, if you are injecting directly one impurity, whatever the main analyte peak we are getting, whether it was 98%, means the particular purity of the product impurity is that 98%. Simply, impurity means if you are removing whatever your impurities and desired active ingredient, we can call it as a purity. The potency itself, it is also similar, but potency which is mainly used to after removing, whether it was having the water content, whether it was having the residual ignition, whether it was having the LOD value, and after all those if you are removing, then you will get the potency. Even similarly assay by using the potency value after you preparing the product, whatever the calculations, whether it was you required acid basis, means after before removing the LOD or water content, whatever the value get, that is acid basis assay. After removing the water, it gets anhydrous basis. After removing the LOD, you will get the dried basis. Okay, this is the simple concept. Next.
Last ఓకే ఈ స్లైడ్లో ఫర్ ఎగ్జాంపుల్ మీకు సింపుల్ మీద చెప్తారు ఎస్ఐ అంటే ఇట్ ఈస్ నథింగ్ బట్ క్వాంటిఫికేషన్ అగైన్స్ ద ఎక్స్టర్నల్ స్టాండర్డ్. సో మనం హెచ్పిఎల్సీలో శాంపుల్ స్టాండర్డ్ ఇంజెక్ట్ చేస్తాము, శాంపుల్ అనేది స్టాండర్డ్తో క్వాంటిఫై చేస్తాం, వీళ్ళకంతా 1%. సో దట్ ఈస్ ద ఎస్ఐ వాల్యూ. దెన్ ఇన్ ద కేస్ ఆఫ్ ప్యూరిటీ ఒక 1000 ppm ఇంజెక్ట్ చేసాం అనుకోండి, 1 mg per ml ఇంజెక్ట్ చేసినప్పుడు మనకి మెయిన్ పీక్తో పాటు ఇంప్యూరిటీ పీక్స్ వస్తాయి, బ్లాంక్ పీక్స్ వస్తాయి, ఇన్ కేస్ ఆఫ్ ప్రొడక్ట్ అయితే ప్లాస్మా పీక్స్ కూడా వస్తాయి. క్లియర్ కదా? ఇప్పుడు మన పొటెన్సీ ప్యూరిటీ చేసేటప్పుడు ఎట్లా ఎస్టాబ్లిష్, దీనికి ఎక్స్ట్రా స్టాండర్డ్ ఏం అవసరం లేదు. ఓన్లీ యాజ్ వెరీ శాంపుల్ 1000 ppm 2000 ppm ఎంతైనా మీరు ఇంజెక్ట్ చేస్తారు కదా, పీక్స్ అన్నీ వస్తాయి కదా, అందులో ఏమైతే ఇదైనా మొత్తం పీక్స్ అయితే వాట్ ఆఫ్ ద పీక్స్ ఎల్యూట్ పాసిబుల్ ఆల్ పీక్స్ విల్ బి ఎల్యూటెడ్ ఇన్ ద సేమ్ ప్రోగ్రామ్. మీరేం చేయాలంటే ప్యూరిటీ క్యాల్కులేట్ చేసేటప్పుడు బ్లాంక్ పీక్స్ మైనస్ చేస్తారు, ప్లాస్మా పీక్స్ మైనస్ చేస్తారు, ఇన్ కేసు అంటే ప్లాస్మా పీక్స్ ఏవైనా బ్లాంక్ డైల్యూట్ ఏవైనా పీక్స్ చేస్తారు. ఓన్లీ అనలైట్ పీక్ అండ్ రెస్పెక్ట్ ఇంప్యూరిటీస్ పీక్స్ ఒకటే కన్సిడర్ చేస్తారు. చేసేటప్పుడు మీకు అది మెయిన్ పీక్ ఫర్ ఎగ్జాంపుల్ ఇంప్యూరిటీస్ తక్కువ ఉన్నాయనుకోండి, 99 వచ్చింది, 1% ఇంప్యూరిటీస్ వస్తాయి మీకు ఏరే నామినేషన్లో, మొత్తం టేబుల్ వచ్చేస్తుంది హెచ్పిఎల్సీ. అక్కడ ఏంటంటే ఫర్ ఎగ్జాంపుల్ మెయిన్ పీక్ ఇంప్యూరిటీస్ పీక్స్ కూడా తీసి అనలైట్ పీక్ మెయిన్ అనలైట్ పీక్ ఫర్ ఎగ్జాంపుల్ 99% ఉందనుకోండి, దట్ ఈస్ ద ప్యూరిటీ. ఓకే, ఈ రెండు డిఫరెన్స్ అర్థమైంది కదా. నౌ పొటెన్సీ. సో ప్యూరిటీ వచ్చింది కదా, ప్యూరిటీ వచ్చేటప్పుడు పొటెన్సీ ఎట్లా క్యాల్కులేట్ చేస్తారంటే, ఇప్పుడు ఆ మెటీరియల్ ఏపీఏ ఉంది, దానికి ఎల్ఓడి ఉంటుంది, లేనప్పుడు మాయిశ్చర్ ఉంటుంది, లేనప్పుడు రెసిడ్ సాల్వెంట్స్ ఉంటాయి, సల్ఫేట్ డాష్ ఉంటుంది, రెసిడ్యూయల్ ఇగ్నెస్ ఏవైతే ఉంటాయి, చెత్త అంతా ఏదైతే ఉంటాయో ఎక్సలెన్స్, ఇవన్నీ ఎస్ఐ మీద ఇంపాక్ట్ ఉంటాయి, ఆ ఎస్ఐ వాల్యూ మీద. ప్లీజ్ కీప్ ఇట్ ఇన్ మైండ్, ఎస్ఐ ఎనీ ఇఫ్ యూఆర్ అనలైజింగ్ ఎనీ మెల్టింగ్ పాయింట్ ఆల్సో ఇంపాక్ట్ ఆన్ ఎస్ఐ వాల్యూ. సో దట్ APA we can decide by measuring the melting point. If melting point is failing, definitely 99.999% of essay definitely will fail. Why? Because if it is a pure material, if melting point is passes, definitely essay will be passed. If there is some impact on melting point, it will impact the purity of that final APA. సో అందువల్ల ఈ వేడియంట్ ఏమైనా ఉంటాయి కదా, మెల్టింగ్ పాయింట్ డిటెక్ట్ చేయని అవసరం లేదు. రెసిడ్యూయల్ ఎలిమినేషన్ కానీ సల్ఫేట్ యాసిడ్స్ కానీ ఇవి కొన్ని ఉంటాయి. రెసిడ్యూ సాలిడ్స్ బై జీసీ మెథడ్స్ ఇవన్నీ క్యాలిక్యులేట్ చేసి పర్సంటేజ్లో క్యాలిక్యులేట్ చేసి పీపీఎమ్స్ వస్తాయి, కొన్ని పీపీఎమ్స్ వస్తాయి, కొన్ని పర్సంటేజ్లు ఉంటాయి కాబట్టి పర్సంటేజ్లో క్యాలిక్యులేట్ చేసి ఇక్కడ ప్యూరిటీ కూడా పర్సంటేజ్ ఉంటాయి కదా, ప్యూరిటీ మైనస్ ఈ చెత్త అంతా వేసేస్తే ప్యూరిటీ మైనస్ A ప్లస్ B ప్లస్ వేసుకుంటే that is the production.
We will show the example. We have a calculation example is also there. I will show the document. I will give the one example. That's why we keep the board here. I will show the one example.
ఇప్పుడు ఈ మూడు డిఫరెన్స్ అర్థమైంది కదా, ఈ మూడింటి డిఫరెన్స్ అర్థమైంది కదా. నెక్స్ట్ ముందు స్లైడ్ వెళ్తున్నాను సార్. ఇప్పుడు ఉంది కదా, యాజ్ ఈజ్ బేస్ రైట్ బేస్ హండ్రెడ్ బేసెస్ ఉన్నాయి. యాజ్ ఈజ్ బేస్ సేమ్ ఫర్ ఎగ్జాంపుల్ మీరు క్యాలిక్యులేట్ చేస్తారు, ఏపీఐ కానీ ఫార్ములేషన్ క్యాలిక్యులేట్ చేసినప్పుడు ఎస్ఐ ఎక్స్టర్నల్ స్టాండర్డ్ క్యాలిక్యులేట్ చేస్తారు. వాట్ ఆర్ ద రిజల్ట్స్ అప్కమింగ్ బై ద క్యాలిక్యులేషన్ ఇది యాజ్ ఈజ్ బేసెస్. క్లియర్ కదా. రైట్ బేస్ అయితే ఫర్ ఎగ్జాంపుల్ ఇప్పుడు ద ఏపీ హ్యావ్ ఏ లాస్ అండ్ రైట్. లాస్ అండ్ రైట్ చేసినప్పుడు ఎస్ఏ వాల్యూ ఫర్ ఎగ్జాంపుల్ ఎక్స్ ఇచ్చింది, ఎక్స్ పర్సెంటేజ్ ఎస్ఏ వాల్యూ ఇచ్చింది. ఎక్స్ పర్సెంటేజ్ ఎస్ఏ వాల్యూ ఇంటూ 100 మైనస్ ఎల్ఓడి వాల్యూ.
I ఉన్నాయి sir. Calculation
ఉన్నాయి.
the better చేస్తాం. Next time.
So that is the right base also. Where in the case of anhydrous అనుకోండి, instead of LOD, if you are doing that moisture content by KF or colorimeter, whatever it is, again the calculation remains same. SS some X percentage into 100 minus moisture content. Moisture content. That result will be as a 100 basis. So simple way మీకు అర్థమైంది కదా క్లారిటీగా. Of course next slide లో కూడా క్యాలిక్యులేషన్ ఉందని చెప్పారు.
Examples each దానికి ఒక్కొక్క example calculation చేస్తాను. You will get
Clear కదా. So calculation
theoretically we will explain after that. And next. So what is the difference between the melting point and melting rate? This is the only simple test we got to even in the last 6 months. This simple test only. But no one is believing that. Even it was not able to identify it in the during review also. So melting point means the specific temperature at which the solid substance transition to a liquid under atmospheric pressure. So for example, whenever the melting point, the solid to liquid converted, that is called melting point. The melting range, the range of temperature over which a substance transitions from solid to liquid, often observed in mixtures or impure substances. In a simplest way, for example, some of the products having the specific melting point means, for example, 280 degrees centigrade. So exactly when it reaches to 280 degrees centigrade, automatically the solid gets converted into liquid. Where there is other substances, there is a range, means they require, for example, 280.1 degrees centigrade to 280.6 degrees centigrade. So in between the range, they will melt. They convert solid to liquid. In a simplest way, the melting point refers to that whenever if your test is representing that, if someone is saying, I want the melting point test, means simply whenever the solid converted to liquid, then those value you can directly refer as melting point. Whereas melting range, whenever the solid starts melting, so whenever they starts, for example, if you are taking 4 mg or 3 mg substance, while you keep it into the melting point of it is, then it starts, the solid will start, then whatever the starting point, and at the end of the solid is completely converted to liquid. So the in between the range you can call it as a melting range in a simplest way. Next. And another most important thing, why often we are seeing that if someone auditors are came into our laboratory or someone while explaining regarding the chromatogram, regarding the histogram, regarding the thermogram, regarding the monogram, regarding the diffractogram. So we always should use the scientific language only. For example, if you want to quote something, you always use the scientific language. For example, if you are referring the chromogram, you always use the referring the chromogram. So likewise, there is an example. What is exactly the meaning of thermogram? The visual representation of the temperature changes over time. The thermal analysis to determine the melting point, crystallization and purity. So for example, pharmaceutical example, the DSC thermogram for analyzing the melting point and purity of the drug substance. So basically, when you are doing the DSC, what exactly we will do? Whatever the printouts we are getting after analyzing the DSC test, then we can call it as a thermogram. In the thermogram means the visual representation of the temperature changes over time. So DSC basically how it works? One is a temperature program and second one is a time. So based on the time interval, the temperature will increase and you will get the graph, onset value, peak value, whatever you are getting. And the second, histogram, where we can call it as a histogram. The graphical representation of a distribution of a numerical data and visualization data distribution frequency analysis. And pharmaceutical example is that histogram for particle size distribution in a powder drug to ensure the consistent quality. So basically when we can call it as a histogram while you are doing the PSD analysis, when you are checking the particle size distribution, how exactly it is happened at the 1 micron, 3 micron, 0.9 micron, 0.5 micron, wherever. So whatever the visual representation, how it comes, numerically it will give. When you are pour the powder inside the equipment, then it will give the graphical representation with respect to the distribution of the numerical data. So what micron size, how much percentage exactly it is there. Then we can call it as a histogram. Monogram, actually it is very rarely used, which is mostly in a laboratory we are not using in that. But monogram, visual output of a chromatography process showing separation of the mixture of component. Modify made by overlapping or combining letters to form a symbol. So basically monogram means if you are representing some symbol while you are seeing any chemical bottle, they are representing corrosive, like toxic chemical. Like whenever if you are representing any symbol, through the symbol, if you are expressing something, then we can call it as a monogram. And chromatograph means visual output of a chromatography process and showing separation of a mixture of component and identifying and quantifying the compounds in a mixture. So chromatograph everyone is known. So chromatographic technique is the separation of from mixture of component to individual components like HPLC and all. Diffractogram, the graphical representation of a material's diffraction pattern, analyzing crystalline substances and determining polymorphs. For example, the X-ray diffractogram for studying the crystalline structure of a drug components to ensure the consistency in drug formulation and stability analysis. Normally, diffractogram where we can call it as whenever if you are doing any XRD, then these are called as diffractograms. Understood everyone? What is the difference between thermogram, histogram, monogram, chromatograph, diffractogram? These are the commonly used terminology in the laboratory. So these are all some precautions while reading the meniscus. So I don't want to go with fully that. So whenever simplest way I can tell that if you are reading any meniscus, if you are observing, so always the eye position should be like this. It should not be low or it should not high. So always the correct position. Whenever if you are observing any rising cylinder, if you are pour something, so always you should use the meniscus value. So simply, if a colorless solution means what we can see? Lower. If it is a color substance, solution means upper meniscus. Nice. So weighing procedures and precautions while weighing. So you always remember one thing. So balance is a very, very key parameter in the pharmaceutical analysis. If you are going any analytical laboratory, the balance is a major key. While you are taking, because of the balance, if you are not treated properly, the number of errors may increase. Because whenever you are using standard weight or sample weight, always there is a calculations involved in that. So balance is a very key. So whenever if you are using the balance, always remember the 4 things. One is your spirit level always should be on the center. And the second, whatever the pan while weighing, so it should be always clean. And third, whatever the printout you are getting, it should be clearly legible, and your date and time, whatever the represented data which is showing, it should be matched with your specification. And fourth, after basically everyone is doing that, before taking weight, everyone taking the balance very seriously because they don't want to cross-contaminate their product, but everyone is doing very clean and neat and but after taking the weight, I have seen most of the cases. So before taking the weight, everyone is following the exact procedures and everything. But after taking the weight, they pour something. For example, he is doing the atorvastatin, I am doing the paracetamol. If you are not cleaned properly, then same if someone is doing the RS test, they may get cross contamination. So there is a possibility. So always with the brush, use the brush to clean the balance surface. Next. So pH meter, I don't need to tell much about it that in the last 6 months, 3 times we got the pH meter electrode breakage. Why general practice is more important? I am telling that if you are not treated or if you are not working properly, it always getting into the trouble. So for example, normally what we will do, if your pH is temperature sensitive or not, pH is directly proportional to temperature. So you always remember, I have seen some of the products, if you are giving, measure the pH at 20 degrees centigrade means you need to take the 20 degrees centigrade only while taking the pH value. At the same time, whenever you are doing any daily calibration, we are doing 5-point daily calibration. So you always use the, whatever the process you are using, it should be hazy free, it should be clean and neat. And always store your electrode into the, what solution we need to store? Electrode? 3 molar KCl solution. Okay. Next. So micropipette. Micropipette is there is a possibility of the, because micropipette is used whenever 10 microliter to 1000 microliter. So in between the range, mostly we often use the micropipette. So always whenever you are using the micropipette, you need to maintain the 3 things. One is always use the fresh tip. Whenever you are using any micropipette tip, always use the fresh, and it should not touch with the bare hands. Okay, there may be possibility of the cross contamination, so you should not touch with the bare hands. And second, so where there is a push button, whenever if you are taking the micropipette volume, so push button should be always used in a consistent manner. For example, if you are doing serial dilutions, if your push button is long pressed than the previous one, your volume may increase. Definitely, your volume may increase. At the same time, so you always remember, before taking any micropipette, so at least 2 to 3 times you will rinse the tip. At least you need to rinse the tip, because sometimes if you are keeping the brand new tip, so while you are taking, sometimes volume may get higher side or sometimes volume may get come lower side. So if you are done with 2 to 3 times, you will get the consistent volume between. Next. So dilutions are the similar. Whenever if you are doing any kind of dilutions, in the simplest way, you will always remember, first if you want to do any dilution, first mark your flask properly. Without labeling of the flask, you never do any dilution. I have seen so many OS is happened because of the, if you are not properly labeled. What will happen? He do all dilutions. He will mismatch the one stock to final dilution to stock. Then he will inject the same and he will get the higher result. It leads to OS. So, and second, always use the dry glass, especially when you are doing any assay test. So always remember, there is a bottleneck. So it should not any wet particle or wet substances, because this may lead to, if you are weighing 20 mg, 15 mg of the API substance into the volumetric glass, if it is stuck into the walls of the volumetric glass, then it may lead to uneven, inconsistent results. Next. And most important thing, whenever I entered into the lab, so most of the people are not aware of the PDM calculations. So this is very, very important. Because if you don't know the calculations means, you can't able to do the analysis for a longer time. So one day you can remember whatever the procedure is, but if you need to understand what exactly the ppm means. 1 part per million means 1 part of a substance in 1 million parts of the solution. So 1 ppm solution means 1 gram of the substance, you put it into the 1000 ml, then you can call it as a 1 ppm solution. 1 micro. 1 mg per liter, 1 ppm. 1 microgram per liter, 1 ppm. Okay, this is what? Simply, you remember, ppb is mostly used for the ICP-MS, LC-MS, GC-MS.
Yes.
1 mg per liter means 1 ppm, and microgram per liter to parts per billion is called 1 ppm. Okay, so I will show the one calculation. So, and second, average weight. How to calculate the average weight? So, average weight is the weight, average is equal to the quantity of the sum of the product, number of value corresponding to the weight divided by the sum of the weights. For example, if you are taking the 20 tablets, so you need to get the average weight. So if you are taking the sum of the 20 tablets weight and divide it by 20, then you will get the average weight. Next. And this is most important. How to calculate the equivalent weight? Equivalent weight means what? Equivalent weight means mostly you see in the chromatography technique or UV also. If they are given 20 mg equivalent powder you need to take, because in the formulations most of the time what will happen, along with the API you will get the excipient also. For example, your tablet weight is a 400 mg, but actual tablet is containing the 25 mg of the drug only. So in those cases, if it is given equivalent weight, it is equivalent to 20 mg means you should always average weight of the tablet or capsule into equivalent weight divided by label claim. Then you will get the how much quantity of the powder you need to take. So because sometimes dropping method is there, sometimes powder also you need to take. You take the 20 tablets, you need to crush it and you make a homogeneous powder, and in this powder you need to take the whatever the equivalent weight. For example, equivalent weight is given the 20 mg. So average weight into equivalent weight divided by label weight. This is the formula. Next. So the rules of significant figures. What exactly significant figure means what? Significant figure means what? Significant figures, why it is very important for the while RS calculations or genotoxic impurity calculations or assay calculations or any other calculations. Significant numbers, important is that all non-zero digits are significant. Remember blindly, all non-zero numbers are significant. If the after point you are getting 10 zeros and you are getting that 1, 2, 3, 4 like these numbers, then 1, 2, 3, 4 are significant numbers. Then whatever the zeros are coming, that is non-significant. So you always remember. For example, if you are rounding, example is given 0.004567 to 3 significant figures. For example, if someone is saying that if the value is 0.004567, so 3 significant figures means you should not consider the 0. You should consider the whatever the numbers are coming, and these 3 you need to consider and you need to round accordingly. Understood? So sometimes most of the people if they want to rounding up means 0.00 I got means they will simply write as 0.00. This is my result. If you are after point, if you are considering, if someone 3 digits means directly they can say that okay 0.004 means I can say that 0.007. So that's why if the after point, if any non-zero digits, significant numbers you need to consider and you need to round those numbers. Okay. Next. So these are all not required. So I will show. So with respect to the calculation, there is a one document is called Guidance Document General Calculations in Indian Pharmacopoeia. Document ID is IPC GD10 version 1.1. Issue date is 8 July 2022. So all of you please gone through with this document which is available in the Google. So download it, you keep with you. It is, you will get far better knowledge with respect to all quality control laboratory calculations in the simplest way. So start with that. Start with that. So here it is what is the given. So I don't want to waste your time much. So I will tell short and crisp to understand for better calculations. So it is because everyone knows everything, but when it comes to the practical, they get the doubts. So to remove all those things in the simplest way I am explaining. So for example, if you want to calculate the molarity. So what exactly molarity means? The number of moles of a solute per liter of a solution. The solute is defined as the substance being dissolved, while the solvent is the substance where the solute is dissolved, usually water. So normally 1 mole of the solution is dissolved in 1 liter of the solution, we can call it. Here it is a molarity. If I want to prepare 500 ml of 0.1 normal NaOH. 0.1 normal NaOH. Now how I need to prepare? There is a simple formula, then no need to hesitate anything. Here M equal to 1000 into W divided by V into molecular weight. Okay. So for example, how much quantity of the molecular weight you need to prepare? Molarity 0.1 normal. So you need to mention 0.1. Then you need to enter 1000 into, you require the weight. Okay. How much quantity of the weight you need to take? You require the weight divided by how much volume you require? 500 ml into what is the molecular weight of NaOH? 40. So then if you calculate, you will get the 2.0 grams. That means if you want to prepare 0.1 normal NaOH means 2 gram of the NaOH, you take it to the 500 ml solution and you can prepare with this 0.1 normal.
So 500 only later or 1000 is 1 year.
Okay? 0.1 normal.
Okay.
In a similar way, you can calculate anything. This is the basic fundamental formula I am explaining here. Everyone understand any doubt? This is the basic, simplest way. At the same way, there is a difference between the molarity and normality. This is called molarity. The same way if I need to prepare normality. Normality if I need to prepare, for example, 1000 ml of 1 normal H2SO4. 1 normal H2SO4 I need to prepare. 1 normal H2SO4 if I need to prepare, there is a formula. So normality can be calculated by using 1000 into W divided by B into equivalent weight. Okay, this is the formula for the normality. Then what you need to do? And there is a formula for equivalent weight. How we need to calculate the equivalent weight also? There is a formula. Molecular weight of the substance divided by N. So here what is our target? You need to prepare H2SO4. So for example, if you want to prepare the H2SO4, so first you need to get the equivalent weight. So you need to calculate the equivalent weight. So for example, here, what is the meaning of N? Here N means the number of replaceable hydronium ions for acids. If it is acid, you will get the H plus. And the number of replaceable OH ions. For example, in the same way you can take it as NaOH. So Na plus OH minus. In the similar way H2SO4. H2 means H2 plus SO4 minus. The simplest way. So we need to prepare the H2SO4. Here how many hydrogen molecules? H plus is there? 2. If the H2SO4 molecular weight is 98. 98 divided by how many hydrogen ions? The 2. 2 divided by 98, you will get 49. These values you can directly include into here. So how much normality you require H2SO4? 1 normal. So 1 normal you require. Then you need to 1000 into weight divided by here volume. How much quantity? 1 liter. That is 1000 ml. Into equivalent weight. Equivalent weight how much you get? 49. That means 49.0 grams. 49.0 grams H2SO4. If dissolved in 1000 ml, then you will get the 1 normal H2SO4. Sir, you have a doubt. Everyone is saying that H2SO4 is in a liquid. So how I need to take the weight? In the simple way, first you need to get the specific gravity or weight per ml of the H2SO4. So here weight per ml of the H2SO4 is 1.84. H2SO4 weight per ml is 1.84. If it is the value is coming for 49 grams, simply you don't need to do anything. 49 grams divided by 1.84, you will get 26.6 ml. If any substance you need to take in a liquid form, the substance which is available in the liquid, but you need to take in a grams. In those cases, simply divide the weight with the weight per ml. At the similar way, if your product is in the solid form, but you need to take it in a ml. For example, you are saying that, sir, H2SO4 is a solid, but I need to take it as a 26.6 ml. In those cases, simply you need to multiply with the how much ml you require. So here what we have done, divided by 1.84. In those cases, 26.6 into 1.84, you will get 49 grams. Understand? Whenever if you want to convert solid to liquid or liquid to solid, you always require the weight per ml value. This is the basics. Any doubt? And most important thing, this is for mostly used for the wet lab, those who are working in the wet lab area, which is very useful. But whatever the ppm solutions, that is useful for everyone. Even it is a wet lab, whether it was chromatography, whether it was a GC, whether it was LCMS, anywhere if you work, ppm solutions are very, very important. So for example, if you want to prepare, if you had a standard, if you have a 50 ml, 1000 ppm solution is there. So basically, if you are go with the AS or ICP-MS, so whatever the standards you are getting in the liquids, that is the stock. So for example, you have the 50 ml of 1000 ppm solution for water. Here it is given sodium. Okay. In this, you need to prepare 100 ml of 100 ppm solution. So what I require 100 ml of 100 ppm solution. So here how we need to prepare? In a simplest formula, C1V1 equal to C2V2. So you just remember, these are the very simple techniques. Once if you are getting the knowledge into that, it is very easy to do the calculation. So here the C1 means what exactly, what you require, you need to prepare the 100 ml of the sodium. 100 ml of 100 ppm you require. So currently what you are having, 1000 ppm of 50 ml. So simply you need to do, how much volume you need to take? V1 equal to C2 V2 divided by C1. Here V1 is that how much quantity you require. That is, we need to be determined. Here C2 means concentration. 100 ppm you require. V2 how much volume? 100 ml. And how much concentration? 1000. Then you will get a 10 ml. This 2 0, this 2 0, this 0, this 0. How much quantity remaining? 10 ml. Simply 10 ml of the 1000 ppm solution you pour into the 100 ml and make up with the 100 ml and you will get the 1000 ppm solution. Any doubt? In the similar way, for example, if you have the given the weight also you need to calculate the similar way. For example, if you want to prepare a standard with 50 ppm or 100 ppm, whatever, for example, 5 ppm solution is required. Simplest way to get the ppm, for example, you require 5 mg in 5 ml. Okay, 5 mg 5 ml into 1000. You will get the 0.00011. So that is called 1000 ppm. If you want to get any time, if you require ppm, simply you do the calculation like this. If you had a 10 dilutions or 20 dilutions, doesn't matter. So for example, 1 gram of the solution you have taken into 100 ml, further 10 ml to 100 ml, further 2 ml to 50 ml, further 3 ml to 50 ml, and then finally you just put as 1000 and do all this calculation, you will get the ppm solution. So based on that, how much quantity of the ppm solution you require, this simply you need to prepare. This is the basics. Next, this is with respect to the ppm solution. And the similar way, if you need to prepare any volumetric solutions or if you need to prepare any standardization methods and everything I will explain. But here I will directly go with the assay calculation. If it is a manual calculation, how we need to calculate the assay calculations. So if it is a manual calculation, so if any manual calculation means what exactly we are getting. For example, if you want to prepare 0.1 molar perchloric acid solution, assay of albendazole by using standardization of 0.1 molar perchloric acid. So if you want to do the any assay calculation, so assay calculation formula is that volume consumed minus blank into calculated molarity into factor into 100 divided by weight of sample into theoretical molarity. If you want to determine any assay value. So for example, if you want to determine assay value, what you will do first? You take the sample and whatever if you want to titrate against, whether it was acid-base titration, if you can take it as acid-base titration, for example. If your sample is acid, you need to titrate with the base. If your sample is a base, you need to titrate with the acid. In the similar way, for example, how much volume? So while you are taking the perchloric acid in the burette, you titration against the sample. So how much ml of the volume is consumed? Then you can mention here. So for example, 18.8 and minus the blank you are getting 0.2. You need to be minus. And whatever the calculated molarity, for example, you are determining 0.1 normal anyway, whatever you are getting 0.101 like this. And then next, whatever the calculated factor, the factor which is given on the sample, the same way you need to enter. That is called 0.02653 into multiply with 100 divided by weight of the sample, how much you are taking? 0.5 grams. 0.5 into theoretical molarity, how much? 0.1. In the simplest way, if you are submitting all these details, if you are calculating, you will get the assay value. This is applicable for any manual titration. So if you are doing any kind of manual titration, this is the formula. Volume consumed minus blank into calculated molarity into factor into 100 divided by weight of the sample into theoretical molarity. Okay? And then next. So how we need to calculate the KF? So for example, if you need to determine the KF means first we need to determine the factor. So in this formula, the factor can be determined as equal to W into 0.1566 divided by V. Here W is the weight of disodium carbonate, how much quantity of the disodium carbonate we have taken. So for example, here we have taken the for example, if you are how much quantity? For example, if you are taking 1 gram, so you just mention 1 gram into 0.1566. So how much volume is consumed for the titration by the disodium nitrate? You need to enter here. So in ml, you will get the factor value. So factor value is normally you will get 5.0 something you will get. So but whenever water content, if you need to determine volume of KFPSA consumed into factor into 100 divided by weight of sample into 1000. So the KF value water content weight by weight. So for example, so what we do if you want to do the any water content test, you take some 200 mg of the sample and you just pour into the reagent. Then after titration, you will get what volume. So for example, there is 3 ml, 4 ml reagent is consumed. Then you need to mention the factor value. The factor value is the 5.0 something. And then next, you need to enter 100 divided by weight of the sample you are taking 2 grams into 1000. Then you will get the water content value. So how much quantity of the reagent is consumed into factor into 100 divided by weight of the sample into multiply with the 1000. Okay.
So
This is K. In a similar way, if you need to determine the LOD, if you need to determine the LOD, so first you need to take the empty crucible. So we will weigh it. We can call it as a W1. Empty crucible weight, we can call it as a W1. And you take the 1 gram of the sample. So W1 plus 1 gram equal to W2. And then alone the sample weight, that is 1 gram. And after drying, if you are going with the drying in the 2 hours or 1 hour based on your requirement, so you dry from. And then the formula is W2 minus W3 into 100 divided by W2 minus W1. So W2 means what? Crucible plus sample. You will get X weight minus after drying. Normally what will happen? After drying, the compound may get something may get loose after your drying. So that is called Y into 100 divided by whatever the sample weight you are taking, 1 gram. You can write that. Then you will get the LOD value. Understood? So LOD means you take the certain amount of the compound and you dried it with the required time and temperature, and again you need to weigh and you calculate it with this one. And the similar way, same. Sulfated ash also in the similar way. There is no any difference. So sulfated ash, what we need, what type of crucible is required for sulfated ash? Platinum. So always you need to use use the platinum crucible. So because we are exposing the crucible to the high temperatures, like sometimes 800 degrees centigrade, sometimes 600 degrees centigrade, like this. It is also similar. You take the empty crucible bed and you take the sample and you treat with the H2SO4, and after treating again you will keep for the bubble furnace for 1 hour, and again you need to cool, and again you need to wait. The formula is similar. W2 minus W3 into 100 divided by 7. But it is also similar one. Okay? And then next UV. So this is UV. There is a two conditions is there. Basically UV what will do? One is the standard method, and another one is the specific wavelength. So sometimes if you don't have a standard, but if you have a specific wavelength, you need to get the observance and you need to calculate. In those cases, this formula is useful. Here it is given SA of trimeslone, dissolved 25 G sufficient ethanol and produce. These are the calculations. I don't need to go in the procedures and all. Simply I will explain the formula how we need to calculate. For example, someone is say that at the 230 nanometer you need to get the reading. Okay? In a simple way, specific observance you are given 230 nanometer or 389. 389 nanometer here it is given. So if any specific observance if they are given means, simply you need to mention the test observance. So after you prepare the sample and you keep it in the cuvettes and you will get the some observance value. So the test observance divided by specific observance where we are getting 389 into 1 divided by 100 whatever the further dilutions is there. Then test dilution divided by test weight into 100. So here you need to remember, for example, if you are measure the sample observance with the 389 nanometer, if I get the observance like 0.390, 0.390 divided by 389 into further 1 by 100 into, there is a test dilution 100 into 50 divided by, you are taking 0.02517 into multiply with the 2 into 100. So this is called acid basis. So whatever the acid basis I explained till now. So I already explained what is acid basis, dried basis and anhydrous basis. Here it is the difference. So if acid basis means without removing any water or without removing any LOD or any sulfated acid, then it is called acid basis. Then you will get the certain value 99.58 for example. The same way if you need to calculate dried basis, the same value you need to calculate dried basis means percentage of SL on acid basis into multiply with 100 divided by 100 minus water content oblique LOD. Here dried or anhydrous. Now you understand the difference. So this is if you are incorporating the test observance 0.390 into the 389 nanometer and further calculations we have given, and you get the some 99.58% value. This is which include water, which include LOD or which include any other thing. So whenever if you require anhydrous or dry basis, simply you don't need to do anything. Whatever the percentage of SA value you are get, for example here I get 99.58 multiply with the 100 divided by 100 minus my water content is 1.0. So then my value should be 99. So 99.58 into multiply with 100 divided by 99, you will get the dried basis. If it is LOD is 0.1, so if you remove the 0.1 from this 100, then you will get the dried basis. Okay?
Can we use the 100 minus water content or
100 minus both will come same. Difference is 100 minus LOD divided by SR acid basis into 100. Yes? This is what you are saying. 100 minus LOD.
SA value into 100 minus LOD divided by 100.
SA value into
100 minus LOD divided by 100.
100 minus LOD divided by directly 100. Simpler है. But in general, if any document, if you are taking, if acid basis means percentage of SA you are getting, those value divided by 100 minus LOD or an water content into multiply with the 100. This is a universal formula. नहीं, फॉर एग्जाम्पल उनका एसटीपी दिया तो वो कुछ तो जस्टिफिकेशन किया होगा, उसका अंदर कुछ करेक्शन है, कुछ फैक्टर्स है, अदर फैक्टर्स में भी इन्वॉल्व, वी डोंट नो. सो बट दिस इज द ऑफिशियल गाइडेंस डॉक्यूमेंट. Sometimes what will happen, I will explain into the chromatography system. If the same formula, we will incorporate the correction factor. For example, if you have the APA, for example, I am taking the atrovastatin hydrochloride, that is in the salt form. So the same atrovastatin, actually we need to get the potency of the SA value of the atrovastatin only. We don't require the atrovastatin hydrochloride. In those cases, we will enter the molecular weight of HCl, atrovastatin HCl, multiply with the molecular weight of atrovastatin with the same assay. In the same assay as its basis, we will incorporate and we will get the desired product. So this is with respect to the specific observance. In the similar way, if you are given a standard, you are given the sample. In those cases, simply you don't need to do anything. Here, whatever the specific observance, here you will write the standard observance simply. So first you will do, you will measure the 5 replicates of the standard, you will get some observance, that is called also 0.390. So in those cases, test absorbance divided by with the standard absorbance into standard weight divided by standard dilution into sample dilution divided by sample weight into whatever, if it is a potency is there, you mention the potency, or potency divided by directly if you put the label plan, you will get the percentage, or whether it was a mg per tablet, if you are required in the 250 mg. So simply you put the potency divided by 100 into average weight. If you put the average weight, you will get it in the value in the mg, and whatever the obtained mg value, again you will convert it into the percentage. I will explain how. So if it is a standard method also, you will understand. Simply, you don't need to do anything. If any, whether it was chromatography, whether it was UV, whether it was anything, the simplest way, test absorbance divided by the standard absorbance, standard weight divided by with the dilution. For example, the same standard you take the multiple dilutions. 1 gram of sample, I dissolve 100 ml, further 1 ml to 10 ml, like this. And same way, for example, sample you are taking to 100 ml, whatever the volume you are taking 100 divided by sample weight into 100, you will get the desired formula. And next, HPLC. So in HPLC, there are 3 types of formulation, 3 types of calculation most oftenly we use. One is if you want to calculate the APA-SA value, or second, if you want to calculate the tablet or capsule, and third, injection or a suspension. So first I will explain the APA, and second followed by tablet, and third, suspension or injection. The APA also similar. So what we will do, first we prepare the standard, and followed by we prepare the sample. If it is API means it doesn't have included any average weight, it doesn't include any other thing. So simply you need to mention test area. So normally in chromatography we are injected something. So whatever you are getting in a areas, in a whatever the number you are getting, this is chromatography area. So test area divided by standard area into standard weight divided by standard dilution into test dilution divided by test weight into 100. You will get the API. Whether it was API means the essay calculation will be like this. If it is API, simple. You don't need to do anything. Simply you need to mention the here directly you can apply potency, or if your potency correction is required, then you can apply 99.5 if it is potency is there. So two way you can write. If it is a potency is there 99.5 divided by 100 into 100. So if you are directly putting the potency, or if you are converting into the percentage, or directly you get this. This is the API formula. Simply what you need to do, whatever the test area you are getting, you need to enter. Whatever the standard area you are getting, same you need to enter. Whatever the standard weight. For example, here the standard weight I am getting 0.05005 means there is a 50 mg of the standard weight. So same you need to enter, and whatever the dilutions you have entered. So for example, I will explain here. My test area is 380 area. My standard area is 380 into what I have taken 50 mg of the standard into 100 ml. Further 1 to 100 ml I have diluted, and after that 100 ml solution I pour 50 mg sample weight into 99.5 potency divided by 100 into 100. You will get the SA value. So this SA value you can call it as a API SA value. This is as is basis. Already I told. As is basis means which include both LOD and water content. Either which one, any one of them. The same way if you require, you need to, for API this is the formula for acid basis. The same way you need to calculate the tablet. Similar way, there is no any much difference. The even if it is a tablet also, the SA formula will be remains the same. Simply you need to add the here average weight. So everything is the same. Test area divided by standard area, standard weight divided by standard dilution, test dilution divided by test weight. Here sometimes if the test weight is a dropping method. For example, you drop the 10 tablets directly into the volumetric flask and you pour the diluent and you mix it. Then it is in those cases average weight is not required. But if you are taking the powder, in those cases here you require the average weight. So in this test solution, so purity of the standard, test area, test dilutions, test area, standard weight, test dilutions, purity of the standard into average weight. If API everything is same, simply you need to add average weight. Test area, standard area, standard weight, standard dilution, test dilution, test weight into potency oblique purity, potency of the standard into average weight. Okay? If it is a tablet means everything is remains the same. If you need to add the average weight, then you will get the as it is. If it is a suspension or injection, so in those cases what you need to do? Average weight is also there, and apart from the average weight, it includes the weight per ml, that is called specific gravity, whatever the weight per ml value. Normally, if you go with any injections while analyzing any injection sample, so weight per ml is the key. So without proper adjustment of the weight per ml, they won't go for the further, whatever the finished product manufacturing. So then, if it is a suspension or injection, Suspension, injection also same. Test area divided by standard area into standard weight divided by standard dilution into test dilution divided by test weight into weight into average weight into potency. Potency unit of course. Okay. After you are getting whatever the value you are getting here. Understand? Everything is same. If it is a API, it doesn't include the average weight. If it is a tablet means it includes the average weight. If it is a suspension or injection, it includes the weight value. Remaining everything will be the same. So this is the basic API calculation. For example, if you want to get the SA value, this is mg per tablet. This is mg for 5 ml or this much ml. For example, 1 ampere is containing 5 ml, 2 ml, 1 ml, irrespective of that. So here I am giving the example. This much mg of this much ml. In the same way, you need to get the exact SA value. Mg tablet, what you are getting here, SA divided by label client into 100. You will get the exact percentage SA value. So for example, you are claiming that your tablet is a 250 mg. Okay, you are getting the SA value of 249 mg. Then you need to enter 249 mg. 249 divided by 250 into multiply with the 100. Then you will get the exact SA value of this tablet. In the similar way, if it is an injection, you are claiming that 5 mg for 5 ml. Okay, in those cases, whatever the 5 mg you are getting, instead of 5 mg, 4.8 or something you are getting. Then 4.8 divided by 5 into multiply with the 100, you will get the SA value. Okay, understood everyone? So what is the major difference if you are calculating API SA? API SA means it doesn't include any average weight. If it is a tablet, it includes average weight. If it is a suspension or injection, it includes weight per ml. This is the simplest way. Anywhere you can go, the formula remains the same. Most of the people think that I have the API experience, I have the tablet experience, I have injection experience. Nothing. If the technique is similar, doesn't bother about the formulation. If the formulation doesn't give any other much difference. When compared with the API, injection analysis is far easy. You don't need to prepare any solution, simply you take the volume, this much of volume, you pour into the flask and you get the design. So, you leave about the formulation, this is the simplest way. Anyone can do any test. This is the expensive related essay. And after that, most important one. So next technique is dissolution. So dissolution is basically whatever our inside in vivo or in vitro. What is the difference between in vivo and in vitro? In vivo means what? Inside the body. So in vitro means? So it's in the laboratory. Okay? Whatever the inside the body conditions you are assessing into the laboratory. So dissolution is a very important technique. Here in the dissolution there are mostly commonly used technique. One is immediate release and second one is the controlled release. These two are very frequent and commonly used techniques. So immediate release, they don't need to do anything. In the calculation also in a similar way. So you prepare the standard and you prepare the 6 balls or 12 balls. You pour the 900 ml on the buffer and you drop one tablet and you stir for or whatever, whether it was paddle or basket, then you need to process for 30 minutes or 45 minutes. Max to max immediate release is 1 hour. So 1 hour, so above most of the drugs will come under the 35 to 40 and 50 minutes. Okay, that is also if you want to calculate the dissolution value. If it is an immediate release, if it is an immediate release means here also, whether it was by using chromatographic technique or by using the UV technique. So both way you can use. So for example, whether it was UV or chromatography doesn't matter. While calculating the result for this dissolution, so both are similar only. For example, this is the test absorbance oblique test area or divided by standard absorbance oblique standard area into multiply with what? Standard weight divided by standard dilution into volume of sample. Volume taken, how much, whatever the dilution, sample dilution. Sample dilution divided by weight of the sample into purity divided by 100 into multiplied with the 100. So this is also very similar. Test absorbance or test area you need to mention here. For example, that is, you can call it as a 390 area you got the test, 390 you got the standard weight is a 30 mg, you dilute it into 100 or the 2 to 50 and then sample how much. Here you need to understand. Basically, if it is a dissolution, means what we will do in a 900 ml, sometimes you may pour 250 ml, sometimes it may be 500 ml, sometimes it may be 900 ml, and sometimes it may be 1000 ml. 1000 ml is the max. The minimum is 250 ml. So here, most commonly used 900 ml I have taken. I have dropped one tablet, 1 into purity is 99.1, 100 into multiplied with the 100. So this is the value you are getting the dissolution. Okay, this is the value you are getting in mg per tablet. So for example, here you got the 390 divided by 390, mostly you will get the whatever the desired 100 mg per tablet. So the value you required means same way. Whatever then you are getting, percentage of mg tablet divided by with the label line into multiply with the 100. Then you will get the percentage amount of dissolved in this particular time, 30 minutes or 45 minutes or 1 hour. So the same way you can get it. Understood? And dissolution. This is for immediate release. So where there is a time point is there, the control release. So for example, we have the 4 time points is there. Everything remains the same. There is no change in the process. Here 4 hour, 8 hour, 12th hour, 16th hour. There are 4 time points is there. So basically, if you are doing any dissolution test, what you will do? First you withdraw the sample 10 ml in the 4th hour, and again you replace with the 10 ml, and again 8th hour you withdraw the 10 ml, and again you replace with the 10 ml. At the same cycle will go up to 16 hours. There is a 4 time points is there. Here also same practice. Test absorbance divided by standard absorbance into standard weight divided by standard dilution into purity of the standard dilution, whatever the volume you have taken, sample dilution divided by tablet or capsule into purity of the standard into 1000 into 100 divided by label plan. So for example, if you are calculating here, because you need to calculate all 3, 4th hour, 8th hour, 12th hour, 16th hour. For suppose, if you are first, you need to calculate the 4th hour. 4th hour you will get the 1 D1 value. Means 6 tablets if you are dropping, the 4th hour you will get the 6 results. D1, D2, D3, D4, D5, D6. So 6 different values you are getting. So initially there is no correction factor involved in it. Okay? You are getting, okay, the formula remains the same, average weight, label claim, everything you entered here. Because here mg per tablet you are not capturing, directly whatever the percentage you are mentioned, you directly put the label average weight here into average weight So the average weight here directly given 1000 actually. So sometimes average weight may be varied. So in those cases, direct label we can mention here. So then whatever the initial 4th hour value you are getting, so that is called D1, D2, D3, D4. So here, where is a drug release? There is a correction factor will be applied for the next hour. For example, the same way if you are adding 8th hour, the correction factor D2 plus C1. Here C1 means correction factor of 4 hour. Whatever the value you are getting in the 4th hour, there is a formula here it is given. Correction factor how you need to enter. If it is a 8th hour sample, correction factor C1, C2, C3. C1 means D1 divided by 900 into multiplied with the 10. So what exactly the meaning is that? You understand carefully because this is very critical. If you don't know how to apply the correction factor, you can't able to do the resolution. So because the correction factor is that after 4 hours, you have replaced the 10 ml with the fresh volume. So this whole D1 value means whatever the value you are getting here, there is a 10% or 12% or XYZ. The same you need to mention here 12% divided by how much ml you pour? 900 ml. 900 into multiply with the how much you replace? 10 ml. So you just mention 10 ml. Then you will get the correction factor. That means whatever the fresh medium solution you have had, the same correction factor will be included for the next time points. The 4 hour directly you will get the D1, the 8 hour you will get the D2 plus C1, and 12 hour D3 plus C1 plus C2, and 16th hour D4 plus C1 plus C2 plus C3. In the simplest way I will explain. The 4 hour there is no correction factor because initially whatever the 900 ml volume you poured, the same way you have taken the volume 10 ml. The 8 hour you have replaced the 10 ml. So that's why you have applied the C1. That is 4 hours value you have kept here. The 12th hour, 2 times you have replaced your 10 ml volume. So then 8th hour, 4th hour, C1 plus C2 you are getting here. Then again 16th hour means after 16th hour how many times you have replaced? 3 times. Then your 16th hour D4 value plus C1 means 4th hour, C2 means 12th hour, 8th hour, C3 means 12th hour. Understood? This is the simplest concept. If you do the dissolution profile or even you do the dissolution batch release single point, this is the concept. Understood everyone? Value calculation will be the same. Test absorbance divided by standard absorbance. If you are observing commonly, anywhere the same practice. But we are all thought that dissolution is different, HPLC is different, UV is different. But anywhere the system, process, calculation will be the same only. Only thing is, whatever the adjustment you are done in this particular technique, the same you incorporated this correction factors and all. Understood? So there is each and every time point, they are clearly given the examples with the values and everything. So please go through this document and get better knowledge. If you have, again you have any doubt, please come to me, I will explain. So almost everyone is dealing. So there are only 2 to 3 techniques is there, almost is completed. So now till now we have completed the UV, HPLC, dissolution, KF, residue ignition, sulfated ash, normality, molarity, ppm and everything. Now we are going to do with the gas chromatography, GC, residual solvents. So residual solvents, how you are doing the calculation. Even residual solvents also, the concept is the similar only. So what exactly the residual solvents means exactly? What is meant by residual solvents? Residual solvents are defined as organic volatile impurities that may remain in active pharmaceutical ingredient substances, excipients or medicinal products after processing. Depending upon the safety data and the risk to the human health, these solvents are classified as class 1, class 2, class 3. So, If you are doing any residual solvent, there are three classes of the solvents only available. Class 1 solvent, class 2 solvent, class 3 solvent. Okay? So class 1, class 2, class 3. These three solvents will be assessed by using the gas chromatography. Okay? Residual solvents means what? Normally what during if you are preparing API or preparing any formulation, normally what type of solvents we commonly use? Either methanol, either acetonitrile, either DCM, either ethyl acetate, either hexane or some other benzene, sometimes toluene. These are all the commonly used solvents. So these solvents will be assessed by using, here we taken the one method, here whatever they assessing gas chromatography by flame ionization technique. So I don't want to go with the details. So here simply we are assessing three solvents. One is methanol and second one is acetonitrile and third one is the DCM, dichloromethanes. These three solvents. The formula remains the same. You come to the formula. Test solvent area. So anywhere you see, first comes with the test absorbance, test area or test solvent area. So here first you need to come with the test solvent and then standard solvent and then next standard solvent weight. So basically what we will do, so whatever the respective solvent weight they have given, they will take the solvent and they will dilute it and the same test dilution divided by test weight into purity of the standard into here we are getting the values in the ppm. So directly they pour it into 10,000. Okay, understand? Same test solvent area. For example, here they will get the test solvent area is like here test solvent area they will get 2150 divided by 3542 into 0.238 weight of the solvent. So dissolved in 100 ml and further 5 to 100 and then 5 ml solution they kept a 0.2 gram of sample weight into 99.9 is the potency and into 10,000. Then they directly will get the ppm value. This is called methanol. Same acetonitrile is a similar, dichloromethanes is a similar. Anywhere you feel difficulty in this residual solvent calculation? Every time, it's simple. Test absorbance or test solvent area divided by standard solvent area into multiply with the standard solvent weight divided by standard dilution into test dilution divided by test weight into potency into 10,000. Okay, this is for GC. And the next, related substance. So in related substance, I don't want to go with in-depthly. So normally, related substances can be assessed by three methods. One is area normalization method, and second one is standard against by using the correction factor value by standard dilution method, diluted standard method, and third one impurity against the impurity. Simplest way. There is no any other techniques. Don't go bothered with any other. Area normalization technique means what? Area normalization technique means what? What you will do? One is area normalization technique. Second one is diluted standard technique. You don't see with this. So there is a lot there given. In the simplified way, I will explain. Diluted standard method. And third, impurity against impurity. We will calculate. If any other is there, you will see that. But most commonly and frequently used method is the area normalization technique and dilution standard method and the impurity against impurity. So area normalization method means simply you will inject the sample, whatever the sample you are injected. So for example, if you are injected any standard of sample, so whatever the area you are getting into the chromatograph, so whatever the main analyte P divided by, so all the analytic areas, simply whatever the area you will get, that is called area normalization technique. So you don't need to do any further calculation. So where the diluted standard method, so you take as a standard, but in RS what you need to do, you have to assess the different impurities. For example, you take the heterostatic, but you are assessing the heterostatic related compound A, B, C, D. There are 4 impurities. But you don't have every time you can't able to prepare the 4 different impurities. In those cases, we use diluted standard method. Diluted standard method means you prepare the standard, the same heterostatic you prepare the standard, and you prepare the sample, and you will inject it in. You will get the whatever the same formula. The test area divided by standard area into standard weight divided by standard dilution into test dilution divided by test weight into, here the response factor value will be included. So RF, sometimes RRF and sometimes RF values will be. So RRF and RF. RF means each impurity during validation we will establish one RF value. Okay? So by using this RF value will be available in the particular method. For example, if you are doing the heterostatic method directly, so the RF value will be included in the monograph as well as whatever the STP if you are in-house and all. In-house also RF value will be available into potency divided by 200 into 100. So if it is average weight, if it is a weight per ml, this is the same, similar way. There is no any other change. Everything will be the same. So this is called, here by using the standard area, by using the standard, you are assessing your other impurity values. Then this is called standard diluted standard method. Okay? So every time you can't able to prepare the impurities. So in those cases, in the during validation, we will establish the RF values for the each impurity. And if you have the doubt, so if it is a known impurity, you say that RF value. Where is the unknown case? What we need to do? Unknown case, there is no need to include the RF value. Simply you remove the RF value and you calculate, and you will get the unknown impurities. Okay? This is the diluted standard. And third one is impurity against impurity. Impurity against impurity means same heterostatic if you are taken. Along with the heterostatic standard, we will add 3 to 4 impurities. For example, in my product there are 5 impurities is there. In 5 impurities, 4 impurities are unstable. Means every time I need to be, I can't able to establish the RF values. In those cases, what I will do, every time when I do the analysis, I will prepare the impurity and I will inject and I will get the impurity area peaks. Here simply what we will do, test area divided by individual impurity area. For example, 4 impurities if you are added. So related compound A means you will add the related compound impurity area average value. If it is a related compound B impurity A means you add the test, whatever the impurity B value you are getting in the test, and the same divided by the related compound B into weight of the impurity divided by impurity dilution into weight test dilution divided by test weight into purity of the impurity divided by 100 into average weight of water. So you can do accordingly. what do you understand? Impurity against impurity means whatever the impurity you are assessing in the sample, you are calculating those impurity against this impurity standard only. Understood? Or any doubts? And the similar way, whatever the standard, there are other impurities. If you want to calculate with the unknown, in those cases, you will use the standard average area directly and you will get the unknown impurity value. Understood? What is the major difference? If it is a diluted standard means there is no impurity need to be included. Simply you need to add the standard area, standard weight, standard dilution, S weight into RF value. You will put for each impurity. For unknown, no need to enter the RF value. Then in the case of impurity against impurity, S dilution divided by whatever this calculation is meant for example, if you are assessing related compound A in the heterostatic means, whatever the related compound area you are getting in the test sample divided by whatever the average area of the related compound A only. You have to enter divided by into impurity A weight divided by dilution, sample dilution divided by sample weight into impurity potency divided by 100 into average weight or whatever. Understand? So there are 5 impurities means related compound B sample area divided by related compound B standard area. If it is a related compound C means you will enter the related compound C sample area divided by related compound C standard area. Understand? Or any other doubt? Okay? This is also similar. If it is a API, if you RS, if you want to do the API, here you don't get any average value, average weight, or whether you are doing any suspension or injection, you need to include the weight per ml value and average weight, both. Understand? So this is all about the today's calculations and